Hi, I'm Dr. Stephanie Chen, and welcome to the HSS Regional Anesthesia and Pain Management Fellowship. This will be one of the most rewarding years of your life. Your year will be busy learning regional anesthesia in the style of HSS, studying for your oral boards, as well as completing an academic track. These tracks are designed for you to focus on a specific area of perioperative medicine to prepare you for your future career, to create a niche for yourself and separate you from the pack. I'm going to be talking about the integrative medicine track today. And I have a video previously recorded. I'll link it up here. And that has some general information about the track as well as discussion with two former fellows regarding the Helms Institute. Today, though, I'm here with Dr. Janet Shin, our current 2024-25 RAPM fellow, who is graduating in less than a month. She is our current integrative medicine track fellow this year and is the first one to finish the AcuMed Integrative Structural Acupuncture course. We're going to talk a little bit about the differences between the two courses and her experience with the track itself. Janet, thanks for sitting down with me today and chatting about your experiences. I'm going to say this right up front. You did such a great job. I'm going to miss you so much.
Thank you, Dr. Chang. I'll miss you as well. And it was a really great year.
Oh, you're just saying that. Okay, great. But I'm glad to hear. So first question I have for you is, and really to all the fellows, is that, there's so many interesting and wonderful tracks offered at the RAPM Fellowship. How did you choose the integrative medicine track, specifically the certification in acupuncture?
So I kind of have a personal history with acupuncture. I've been a supporter of acupuncture, and I thought it was such a great opportunity this year to have be able to finally learn this new style of medicine and gain proficiency in acupuncture.
Yeah. Did you have any specific personal experience with acupuncture?
Yeah, for sure. So when I was 10 years old, my grandmother visited us from Korea, and while she was here, she suffered a very severe stroke. And then so she was paralyzed on her right side, and then she missed the window for TPA and all that. She was in the ICU for weeks and weeks, and she did physical therapy, occupational therapy, the classic traditional therapies, but wasn't really improving that much. And then one day we took her to an Eastern medicine physician who's also a very skilled acupuncturist, and with the needles in place, she was walking. And then that's something that I experienced with my own eyes, and that's when I realized that this is amazing, and it's something really worthwhile to pursue.
Was this the first opportunity that you had to pursue, medical school and residency?
Yeah. So when I started this medical school journey, I never thought I would even have a chance to learn acupuncture. So I was just so surprised when I applied for this fellowship, and they said one of the academic tracks is learning acupuncture. So that got me really excited.
Oh, good. I hope you had a good year.
Yes.
So getting back to the fellowship track itself, what were your thoughts about going into the fellowship and certification, other than you really wanted to do it?
So I had been forewarned that this track might be more time-consuming than some of the other tracks. As it makes sense because I'm learning an entirely new skill and an entirely new way of thinking about medicine. But like I said, this is such a great opportunity. I didn't think I would be able to have this opportunity in the near future, so I decided to go for it.
Yeah. Do you think you spent much more time over your co-fellows and their other tracks?
I think yes. There are.
It's not sugarcoat that. Yeah, it's a lot of time.
I'll discuss more about what the course entails later on in this discussion. But some of the other tracks do involve, like going abroad or going to conferences, doing projects. But I think the acupuncture course is all that, plus a year-long course that you have to keep up with. So in that respect, it is more time.
Right. Good. We'll definitely talk about the other, logistics of it a little bit later. But, in the past, our fellows have done the Helms course, and you're the first one to do the AcuMed Integrative Structural Acupuncture course, simply because of some, scheduling things that have changed. What's sort of, the differences that you're aware of, because you never took the Helms course either?
Right. So AcuMed, so it's an integrative course. So first of all, the acupuncture that we learn is focused on the Japanese style of acupuncture. The instructor that teaches the course learned from kind of a master in Japan. So that's kind of the style. That's the style that's taught to us. It stems all from traditional Chinese medicine. So like the meridians and the points are the same, except for some slight differences. The major difference, I would say, with Japanese acupuncture is it focuses on hara diagnosis. They say the abdomen is kind of the center and source of all the meridian and the energy flow in our body. So we use diagnostic reflexes in our abdomen to find the precise acupuncture point locations. So that's a difference. And then I guess there are some stylistic differences because of this. Japanese acupuncture uses thinner needles because they use the reflex as opposed to kind of the sensation, the chi sensation we say in traditional Chinese medicine. So those are some of the major differences.
Yeah. Did it affect anything that you did with me at HSS?
No, not at all, because like I said, it's all rooted in kind of the same theory, and we also learn about battlefield acupuncture, auricular acupuncture, and it's an integrative course. So we also learn like cupping, moxa. It's very, very broad and integrative and comprehensive.
Right. No moxa or fire in the operating room, unfortunately, or cupping. But tell me a little bit about the certification process through Acumen. You know, how many hours, like logistically, time of studying, et cetera, out of town sessions.
Yeah, so it's a 200-hour online module course. There's a course syllabus. They have a couple modules, about maybe 9 or so modules each week to do. With each module has a quiz, so you're doing about 10 quizzes a week. And then there's 2 webinar sessions, which is at home, but it's live webinars where the instructor is kind of going over more technique things and demonstrations over the internet. And then there's 2 live weekend sessions. So those are 4 days near Boston. I think the exact location changes every year, but so it's Thursday to Sunday, and that's when we learn even more styles of acupuncture and is able to practice on real patients and each other.
Yeah, no stabbing over webinars. It's a little hard to do that. How'd you find those?
They were long weekends.
Yes.
They were long weekends, but
she's just on fire the entire time. You get stabbed all the time. Yeah.
So yeah, during those sessions, we practice on ourselves, and I think like part of acupuncture is being able to do it on ourselves. Like I would never do anything to a patient that I would never do to myself. So we practice on ourselves. We are encouraged to find partners to practice on. So they're long sessions, but they're much needed.
Yeah. Have you practiced anesthesia on yourself?
Just acupuncture.
Yeah, just the acupuncture. Okay, we're just getting that straight right now. Cool. And so, like, what does the time commitment structure look like? I know you talked a little bit about that. I mean, go into a little bit more detail.
Yeah. So the online modules are self-paced. There are suggested deadlines. Just so you can keep track and stay on track. But they're very forgiving with those deadlines. So like I said, a lot of our fellows this year have to take oral boards. So if at any time you need to focus more on oral board studying for a couple weeks, then it is okay to kind of put the acupuncture modules on hold and come back to it at a later time. That's totally okay. It's self-paced, and it's a lot of repetition and a lot of solidifying the content during the webinars and the live sessions. So that's great.
Yeah. So you didn't find that, we've been doing this since 2019, and every year everybody always says, yeah, we hear how much work it is, but then they're like, oh my God, it's actually a lot of work. And in terms of like oral board studying, sometimes there's a little bit of, your priorities are sort of pulled away, and, just she's a superstar. So, she's fine either way. But for some of the other ones, they were like, oh, studying this new way of thinking and studying for my boards, which are very, very important, sometimes was a little bit, at odds with each other. Like when would you recommend, I don't know, like scheduling your boards, because you guys have options to do that now too.
Yeah, for sure. So I think the way we schedule our oral boards now is through a lottery system. So we rank our preferences for which week we prefer, and then unfortunately it is a little random then, because then they select one of those that you ranked. I would say I think looking back, I would have preferred maybe the earliest date to take my oral boards, like in March, so that earlier on, I can focus on my oral boards, get that over with, and then the rest of the year, I can really focus on acupuncture. I would say maybe try to avoid April dates because one of the live weekend sessions are in April, so that might overlap, and that'll be like kind of logistically difficult to work out. I had the late May session, which is fine too, because then in the beginning of the year I could focus on acupuncture, and then you know in May focus on oral boards, and then go back to acupuncture.
Yeah. It's you'll know the dates before you actually sign up for it, so you'd be able to adjust your oral board dates theoretically around that. But all of the course registration and the travel, all of that would be covered by the department. But when do your responsibilities? So you said you're studying acupuncture beforehand, but when does the course actually start?
So the actual modules, the first set of modules, the earliest deadline is early October. And then I think the first live webinar sessions are as early as November. And so that's kind of when I started the course. Yeah.
So I think for this coming year, I think registration actually is anytime between October 6th. But every year it changes a little bit, so we adjust to their schedule as well. So being able to be flexible is important on that. What was something that you wish you knew about the track before you signed up? Make it good.
Something that I wish I knew about the track. I think I didn't realize how much I would enjoy it. I think it's really a privilege to be able to learn this year. It's a very unique opportunity, and I recommend anyone who's even remotely interested in it, like, take the opportunity. At the live sessions, you'll meet so many physicians in so many walks of life, different specialties that are there and interested in the same topic as you. And I think as I learned acupuncture, I saw so many perioperative uses. It's not just something you do at a clinic, outpatient. It has many perioperative uses, and HSS is a unique place where you get to see intraoperative acupuncture by some of our own anesthesiologists. And combining the learning the acupuncture with seeing it in action, that's an invaluable experience.
Yeah, it's unique to our tracks. So you're studying this thing that is completely different way of thinking in terms of from medical school, from residency, and then you're adding it to something that we're already to the Western medicine that we're already committed to, and we're adding another adjuvant that's non-pharmacologic, doesn't have almost any side effects. Not to say there's no side effects, there's always some side effects, but no major side effects, and really having an impact. So learning that and then seeing it already in process and having such an impact on patients is really, really helpful. That's great. Excellent. How is this, you talked a little bit about it, but in HSS, and you're leaving us in a month. How is it going to influence the rest of your career?
So like I said, I was kind of very fortunate to see it in action in the OR. Now I know that this is something that is possible, and it's something that does benefit patients. We have the data. And then I've uncovered more and more, a deep dive into kind of all the perioperative uses of acupuncture. I think I'll be excited to, wherever I go, it's going to be my mission to try to bring that benefit to patients. Because at the end of the day, it's for the patients. Yeah. It's not about me. It's about, I know that this benefits patients. So I think wherever I go, I'll be kind of getting the buy-in from the surgeons and the department into kind of introducing this idea. Yeah.
The best way to get the buy-in is to treat them. And they're like, oh, okay, we know this works now because it worked on me.
I'm really interested in like the intraoperative acupuncture that we do at HSS. Bringing that to my next place of work would be great. I think also I've been really interested in how we can kind of serve as rescue analgesia or like rescue post-op nausea vomiting treatment. It's very effective for that. And I think there's where I will be practicing, there is a robust regional kind of service. It might be like very beneficial to introduce like acupuncture skills to the physicians there as kind of very quick rescue treatments, and start from there.
Yeah. And California, she's going to California. Sad. Actually has so there's there's two things. There's the state law and then the institutional law. So California only requires you to have an MD, whereas New York State you have to have the certification. So all you have to, if you do like a mini course, then and the institution allows it, then the doctors are actually able to do it as well with very minimal extracurricular trying to lobby the state stuff that we're trying to do right now. Yeah. So, it really sounds like you had no regrets choosing the track. Good.
Not at all.
So let me ask you, what was your, just sort of more broadly, what was your favorite part of the fellowship, and then we'll go more specifically with the track.
My favorite part of the fellowship, just to be broad, just experiencing regional anesthesia in a new environment, and kind of seeing how important regional anesthesia can be in surgery. A lot of residents, I think, come into regional fellowship thinking that regional anesthesia is kind of just more of a adjuvant, like a little sprinkle, like plus like extra, for anesthesia. But at HSS, I saw that it can be such a fundamental aspect of anesthesia that really benefits patients. So that's kind of been my favorite part of this whole fellowship experience.
And your favorite part of the track?
Favorite part of the track is my mentors.
Yes, that's right. That's right.
Of course.
That's right.
This is also something as an aside, but I think this track truly has the best mentors. Like I'm not making this up or
I paid her
anything.
handsomely to do this. Yeah.
My mentors, Dr. Stephanie Cheng and Dr. Chris Lee, have been present and just present during my entire year. It's not just a formality. Here are your mentors, and then you never speak or hear about them again.
We've all had those experiences. Yeah.
But they are there to help you. They're a great resource during the entire year.
Well, that's great. That's great. My favorite part was when we went to a show and was able to witness, your fellow crying in an environment that wasn't the OR. So that was great. That was great. Anything else you would want to tell future fellows who do or will or will not participate in this track?
I think honestly, it's wherever you go, you get out of something what you put in. So make the most of this year. This is an incredible institution to be learning regional anesthesia. So make the most of it. The attendings you meet here are excellent. They're knowledgeable. They're skilled. In terms of acupuncture, like I said, I can't stress it enough how much it can benefit patients, and it works. So if you have even an inkling or even a small little interest of should I try it, I would say take the opportunity, go for it.
Yeah, but realize it is a lot of work. So and it's 9 months of your life, but very, very rewarding. Very, very rewarding. I always say when I go and give talks other places, I was like, being able to bring this modality to patients has really helped with, their health, but also with my mental health, because I'm, didn't realize how much of a team effort this is, how much how much patients can really benefit from you and look to you sort of as, a provider that's front-facing rather than just back-facing on the anesthesia end. You're like, okay, go to sleep, okay, you wake up, and then I never see you again. So I have patients who contact me and email me saying, hey, I'm having this done, are you available? And so it's really, really, really an amazing endeavor, really. All right, excellent. Janet, thank you. I'm going to miss you so much.
Thank you, Dr. Cheng. I'll miss you too.
Yeah. But if you guys have any questions, feel free to contact us. We're happy to chat.